Hi guys, hope you're all keeping well. Just doing a quick video for you today on the condition Osgood Schlatter Disease. This is a condition that I've seen so many times throughout my clinical career so far. Before doing medicine, I was a physiotherapist, and so in the pediatric musculoskeletal outpatient department, we used to see lots of kids referred with Osgood Schlatter Disease. And it's also a condition that I see quite a lot as a GP, because my second degree was graduate entry medicine and surgery. So lots of teenagers presenting to primary care with this condition. So it's important that we're aware of it, how to diagnose it, and of course, how to manage it. So in terms of what it is, Osgood Schlatter Disease essentially is a condition where you get tiny avulsion fractures of the tibial tuberosity. Now, what's an avulsion fracture? So an avulsion fracture essentially is a term used to describe a small bit of bone that breaks away where a bone attaches to a ligament or a tendon. So if you look at your quadricep muscles, which are in the anterior part of your thigh, front of your thigh, you run your finger down, you come to the kneecap, you run your finger down a bit more, you come to a soft jelly bit, which is the patellar tendon, and you go a step further, so you slide your finger down your leg again, and you come across a bony prominence. That's your tibial tuberosity, and that's the bit that's injured in Osgood Schlatter Disease. In terms of why it happens, so it's more common in teenagers, specifically teenage boys, but teenage girls get it as well, especially those who are sporty, because their quadricep muscles develop very quickly, often much quicker than the bone is developing. So what you'll find is that you get classically anterior knee pain, which is worse on activity, and normally it's sort of jumping and running or excessive kneeling, so when you're hyperflexing the knee for long periods. In terms of diagnosis, the history is very important. And of course, the clinical examination is very important. So when you're examining the child, you've got, or the teenager rather, there's three things that you can look for. So the first thing is tenderness over the tibial tuberosity, and often it's quite thick as well when you palpate. The second thing is if you're gonna, you get the child to, or you get the, I keep saying child, but you get the teenager to resist extension of the knee. And when they try to straighten their knee with you resisting, they will get pain over the tibial tuberosity. And the third way is to get your patient to lie prone and you hyperflex the knee. And then what you'll find is, again, they get pain over the tibial tuberosity. X-rays are not recommended for the diagnosis according to the current CKS guidance from NICE. And that does make sense. It's not uncommon for radiologists to send back the referrals from GPs who make a referral with the reason for the referral being query Osgood Schlatter, because they do say it's a clinical diagnosis, it's unnecessary radiation. In terms of managing the condition, important things to let parents know and let the teenager know as well is that it will get better with time. It normally settles down over a period of a few months. Paracetamol, and if there's no contraindication, then ibuprofen can be used as and when needed. Ice packs are very good. Patellar straps are very good because they can support the knee. Activity modification and stretching of the quadriceps is crucial in the management of this condition. And also physiotherapy. So as I said, I was a physiotherapist before, and physios see a lot of Osgood Schlatter Disease, and what they do is they do graded rehabilitation of the knee that allows the condition to get better over a period of a few months. I hope you found that useful. We've got a lot more revision videos on our YouTube channel, Inspire Medics, as well as learning cards and videos on Instagram, Inspire_Medics, and our Facebook pages for PLAB 1, PLAB 2, and the combined AKT and CSA revision group. And last but not least, we're also on Twitter, where Inspire_Medics is your port of call for alternative medical news, so you can keep up to date with what's going on in medicine at the moment. So we'll see you guys soon.